So our smiles are very important because they make us friendlier. If we feel good about our smiles, then life is just better. Well, there's a secret to keeping them nice, and I've got an expert with us today. We've got Dr. Jason Campbell back with us.
Hi, Sandy. How are you?
Good. Well, you're a general dentist, also owner of Pro Solutions Dental and Dental Group. You also do family, implant, and reconstructive dentistry.
Yep, we do basic services, and we get very, very complex with surgery and reconstruction for those patients who need it.
Well, I have a young visitor at my house, and she's 11, and I am always saying, brush your teeth, brush your teeth, brush your teeth, and take your time, because I say your teeth are very, very important to you. Well, sometimes, you know, inadvertently you lose teeth or whatever. There's so many new technologies, but one is laser.
Absolutely.
So many things are done with this light medium, whether it's, well, weapons or healing or art, you name it.
Even just pointers, you know, you can use on a PowerPoint screen.
Yeah, my cat loves them.
Yeah,
you know,
exactly.
little play
Great
toys.
toys keeps the kids entertained.
So what do you do with lasers in your dentistry practice?
You know, it's interesting because it's technology that is forthcoming. It's kind of new to the industry, but the technology is showing really amazing outcomes. You know?
Is it different? Is the laser that you use different than the lasers we were talking about?
Yeah, I think, you know, most people are accustomed to some form of laser. You know, it's light amplification. It's increasing the energy of the wavelength of light. And so depending on your wavelength, depending on the light source, you can change that energy to do different things and target very specific things.
Wow. So what do you target?
Well, so the way we use lasers is we're trying to either, we use it in surgery, we can use it to treat cavities, or we can use it to treat and heal gum problems. You know, people are suffering with gum disease.
Yes.
Yeah, we can take that laser energy and we can focus it down to a very specific tissue structure. So for example, if somebody's having a problem with gum disease, we can take that wavelength of light and we can increase its energy to excite just the cells of that bacteria, where we can go in and we can obliterate.
And then they kill each other?
Yeah, well, the lasers kill the bacteria.
Have a war,
by,
they get
by
excited?
Yeah. So what happens is the internal structure of the tissue becomes very excited until it explodes.
Okay, so this is like the laser, you know, like the force be with you.
Yeah.
The laser sword deal.
A little bit, yeah. So we use heat lasers and we use cutting lasers. You know, we have different types of lasers. In fact, there's another type of laser that we're using. If we're using it on tooth structure, it's a cold laser. It's a CO2 laser. So we can cut tooth structure, which is very different than cutting tissue, which is also very different than just attacking bacteria that might be harboring underneath your gum tissue. It's really, really cool technology.
Is this kind of new, or has this been out for a while? How long have you been using it?
It's like any other technology. You know, the technology is there. It's in multiple industries. In dentistry, it's been around for many, many years. But affording the technology, educating the doctors, getting it into the practices, that's taken a while. So it's becoming more and more popular. Still one of those things that has a lot of room for growth. You know,
I'm sure there's like a learning curve on that kind of stuff.
Yeah.
Okay, so I have a big question.
Yeah.
I think that people are more afraid of the sound of grinding tools and things in the dentist's office than actually even the pain.
Yeah.
Now, does laser, you're talking about working on tooth structure, you're kind of doing away with some of those whirring sounds, or do you still use those too?
That's one of the most beautiful things about it. The downside of a laser is it can really only be used on the tooth structure. It can't be used for everything that we do in dentistry, like when we have a lot of tooth reduction to be done, but if somebody has a cavity in a virgin tooth, a laser can be used. A lot of times the laser excites the tissue so much it numbs it on its own. So it takes away the need for anesthetics. Right. So this is a really great product for kids. You know, when you know, kids are so afraid of the needle, they're afraid of the anesthetic. And so lasers can be a real advantage to kids, even to adults who are afraid of the dentist.
Oh,
and,
yeah. Adults
so
are, you know.
There's virtually no noise. The laser makes a sound of its own, but there's no noise. You don't feel that, and you get to avoid some of the
I wish I'd been around when I was 9 years old, because I had like a bad experience with like a needle thing, and so I never get numb for anything. Yeah. It's like, oh no, I'll take my chances.
Isn't technology amazing?
But now lasers, you don't have to worry about that at all.
Exactly.
This is phenomenal stuff. Okay, so the benefits to people have got to be huge with this new laser technology, all these three different legs of it.
One of the things that we've talked about are the primary things that cause tooth issues. Forces that beat teeth up, acids that cause cavities, and inflammation that causes gum disease. So we can use lasers now to get in there and get at that bacteria that's inducing the inflammation, that's causing bone loss around your teeth, and we can do it in a way that's really virtually painless. So a lot of procedures that I used to have to do surgically can now be handled with a laser in a closed surgical environment where we don't have to numb everybody up, we don't have to reflect their gums back, and we can treat, you know, some of these problems very simply just in our hygiene team, rather than spending more money, more time, more involvement on my side of the practice. And so lasers is really helping us as practitioners to provide services to our patients in a much more convenient way.
Better, easier
Yeah.
for everybody, you know, in this kind of thing, efficient. So can you, I mean, I've heard that there's no cure for periodontal disease. Is lasers changing? Are they changing that?
It doesn't change it. So periodontal disease it's a bacteria problem, it's an inflammation problem. There's a lot of factors that can induce it, some health issues. Some of it can be genetic based. The deal with periodontal problems is control. You have to stop inflammation if you want to stop the progression of gum problems.
Okay.
So it's an ongoing thing, it's a maintenance thing, and that's why we really encourage for people to get out, see their dentist for routine exams, routine cleanings, because it's the only way we can stop that inflammation from really damaging the tissue. So,
well, and another thing, I know robotics are becoming really interesting in surgeries, and they're cleaner, they're better. They're, you know, I had a friend who had a knee operation. It took her 3 months normally, and then she had a robot one. Bam, she was on her feet that week. Is it same that you're seeing with laser surgery and kind of things? Is the healing better, easier, that kind of thing?
The thing that's amazing in lasers, you know, when we're using scalpels or we're using other like electric cauterizers and things like that, it creates a lot of tissue damage. The incision line of a laser is so precise, and the residual damage to the tissue around it is so minimal.
Just heals right up.
It does. It creates very clean margins. It decreases the amount of inflammation and tissue damage in the aftermath.
I tell you,
it's really
I love
amazing
this,
stuff,
Dr. Campbell,
yeah.
because you've got some magic tools here. We talked about digital before, a lot of things, but anyway, laser are really changing the way that, you know, you guys could become real popular dentists. People might not be afraid to come anymore.
I know, exactly. Between that and IV sedation, it's a great combination.
Not that there was a reason, but you know how it is. Thank you so much, Dr.
Thanks
Jason
for having
Campbell
us,
with the
Cindy.
Pro Solutions Dental Group. Wow, great information. All right, don't you go away. We're going to be right back on Arizona Daily Mix.